introduction, the CO2 laser has been the gold standard for treating deep wrinkles, pigmentary changes to the skin, and acne scarring. The problem with the traditional CO2 laser is it would cause weeks of downtime where people would look really bad. They couldn't even go to work. So most people couldn't tolerate that. The Active FX and Deep FX treatment that we're going to perform on Denise today is an advancement on CO2 technology because it fractionates the laser beam. During each procedure, only a fraction of the skin surface is treated. This leaves areas of skin that are intact, aiding in the healing process. So it takes what would happen in a traditional CO2 treatment, taking weeks of downtime, to just about 3 or 4 days. Denise is getting the Active FX treatment first. We did put a numbing cream on her for about an hour. We've just wiped that off, and now we're ready to begin her treatment. The Active FX we're going to start with, and we'll start right between her eyebrows. And you'll see it lays down small white dots. Michelle, my assistant, is holding a pulling device and a suction device. Now you can see the tiny little dots across her face. This is creating micro injuries that penetrate down to the dermal layer of the skin, and it will intensely stimulate collagen production in the area, giving her an overall tightening, plus resurfacing several layers of her superficial skin, giving the skin a smooth, polished, clear appearance. Well, bridge therapy is what the laser company, the Luminous laser company that makes the Active FX, it's what they like to call this particular treatment because it leaves areas of intact skin which are like bridges for healing. So the skin that's damaged with these little micro injuries will heal with the bridges of intact skin, allowing for a quicker heal time and a quicker recovery time. With the cooling device that Michelle's using, it helps to provide comfort. This is a very warm sensation, and it does cool the skin, making the patient feel a bit more comfortable. Really, the next 4 hours is most uncomfortable. The patient feels sort of a very bad sunburn sensation for about 4 hours. During this time, I recommend that patients lay like full compresses on the face. You have to be very, very gentle not to scratch the skin, as the skin's already irritated. And then after the cool compresses, you'll also keep on an emollient ointment to rehydrate the skin. Sometimes even patients like to use frozen peas or frozen corn. They lay very nicely across the face instead of using ice cubes. After about 4 hours, most patients describe just a mild sensation of a sunburn, and that's how they remain for about another day. Overnight, there can be some increased swelling in the area, especially around the eyes. That usually happens overnight. It continues for about 24 hours, and then it starts to dissipate. And then at about day 4 or 5, depending on the depth of the treatment, we usually notice the skin begin to heal. And it doesn't flake in large chunks. These little tiny dots just seem to flake off as you moisturize and wash the skin. After that, sometimes people can experience some redness for a few more days, but that can easily be covered by makeup. Usually within 2 weeks, the skin is returned to perfectly normal. In about 5 days, most people look normal, but some people, it might take them an extra week to resolve all the redness if we do a particularly deep treatment with the Active and Deep FX. With just the Active FX, most of the patients look fine in just about 5 days. Well, the patients I have seen and spoken to, they describe their skin looking like it's been burned for about a month with the traditional CO2 laser, to the point that they would not go out of the house. When that laser peels, the traditional CO2 laser, usually it's large areas that peel off. So it's very difficult to hide with anything. It looks very abnormal. With this, with the fractionated beam, the peeling is just kind of a flaking off of these little micro injuries. And it's much more tolerable. Results are very remarkable. It's an extremely noticeable difference. People get many, many compliments. Even if people haven't seen them during the recovery process, I hear all the time from the patients that friends and relatives notice a big difference in the skin. And you'll notice an initial tightening to the skin, and then over the course of the next 3 months, Denise will experience a continued tightening as collagen grows. Collagen continues to grow from the day of treatment for about 90 days. So it's an immediate tightening, an immediate smoothing of the skin, and then a prolonged tightening over 3 months. So her total result will be evident in 3 months. Well, an IPL is an intense pulse light device. It's actually not a laser. It's a broad spectrum of light, mainly used to treat superficial pigmentary changes. Some studies show that it can also cause some skin tightening. It's often sold as a photofacial, but the level of collagen stimulation is nowhere near with the CO2 laser, and it just cannot penetrate as deep. I'm going to laser Denise's eyes. You can see she has a shield in her eye to protect her vision. Putting the shield in enables me to laser her entire eyelid safely. She doesn't have to worry about her vision at all, and we can get tremendous tightening of her eyes using this method. Before we put the eye shield in, we did numb the eye and put a lubricant in it. Now we're putting a spring water gel on Denise's skin. This will cool the skin and start the rehydration process. Denise also has the cooling device that she's blowing on her own face to make her feel more comfortable. And we'll let her cool like this for about half an hour before she goes home.
How long will the results of active FX last?
Actually, they can last several years with proper sunscreen and skincare. The most important thing is that people wear sunscreen every single day to protect their skin from the damaging effects of the sun. That's what causes a lot of collagen breakdown. We just stimulated collagen production, so you don't want to break it down by exposing yourself to the sun. And it's not just in the summer months. You also want to wear sunscreen every day to protect yourself from UV light and also just transient sun exposure from walking, driving, those types of things.